All right. Hello, everybody out there, and welcome to the Hack Surfer Hangout today. Pretty exciting. This is our first ever, I guess you want to call it a panel-style hangout. We got three guests with us today. We have Jason Polancich. He's the founder of SurfWatch Labs. Barry Johnson, the president and co-founder of Dara Security. And Kevin Jones. He's the senior security architect for Thycotic Software. So today we're going to be, for about the next hour, just kind of chatting, pretty informal chat, just kind of about some of the issues in healthcare sector. If you guys have any questions, there's actually a Q&A app right on Google. You can go ahead and type in any questions, vote them up or down. If there's anything you want answered, we'll try to get to them. But I guess to kick it off, just a little background on why I guess we decided that healthcare was a good topic to cover for our first webinar. You know, if you read the news, there's a whole lot of kind of speculation and warnings sort of from agencies like the FBI saying that the cybercrime in the healthcare sector is on the rise, and kind of the stats sort of back that up. So I don't know, maybe Jason, if you kind of want to get us started and just kind of in general, do you agree kind of with what we're seeing in a lot of these news stories, that cybercrime is on the rise in the healthcare sector?
Thanks, Jeff. Yeah, I think I generally agree. Pretty much across the board, healthcare is a target-rich environment. So cybercriminals, cybercrime activity in general is always going to be focused there. I think we're starting to hear a lot more about it, particularly in the areas of insider threat, insider cybercrime, supply chain cybercrime in healthcare. There's a lot of outsourcing, there's a lot of data handling, a lot of data storage, a lot of data, period. And in general, the healthcare industry resembles in a lot of ways the consumer goods industry, and we all know how that's going right now with Jimmy John's, Home Depot, Target going back to last year. I think in general, statistics show a pretty big rise from what we're seeing.
Mm-hmm. Barry, maybe you kind of want to follow up on that. Is there anything that sort of stands out to you in terms of maybe why there's so much cybercrime in the healthcare sector?
Well, I agree with Jason there that it has increased, and part of the reason I think is because it is such a target-rich environment where you have a lot of patient data. There's a lot of personal data for individuals, so it makes it a good spot for cyber criminals to go after. It makes it easier for them to perpetrate identity theft and whatnot when they steal that information. And plus, there's a lot of other black market materials that get taken out of that as well. But at the same time, it's not all, as Jason indicated, it's not all people from the outside. They have a lot of internal or insider threats where they have people just doing the wrong thing. Some of it's intentional, some of it's inadvertent, where they lose a laptop, they lose a flash drive that has unencrypted data on it. That happens a lot as well. And it's just, like I said, it's just an environment that has a lot of data that a lot of people want. And it's should be really protected a lot better than what it is. And it's a market that has a very low profit margin, for lack of a better term, and so they don't have a lot of money to spend in the security areas, and people know that. It's not like in some other areas where they're just not doing it. Hospitals and whatnot don't have a lot of money per se, and it's tight, and so for them to spend that money in security, it's something they have to really look at. So.
Mm-hmm. And Kevin, I don't know if you have any kind of thoughts in general on the issue?
Yeah, I have to agree with Barry's kind of last sentiment there. Is I think a lot of it's very budget related there. Some problems that are around there is IT, in particular around security. They're just very fast-moving targets that are very difficult to keep up with for even big companies that do have big IT security budgets. And when you bring this back down to a healthcare organization where the Affordable Care Act is kind of mandating that they digitize these records, but also in doing it in such a way that's cost effective. I mean, they don't really have a lot of leeway and budget to get these kinds of things done in a timely fashion. So I think a lot of what we're going to see in healthcare is they knew it was a problem, and it was a potential problem, but because of budget and things like that, they just didn't have time to action on it.
Mm-hmm. Yeah, we have I'll go ahead. Oh, maybe that's just my voice echoing. Sorry. So I'm going to share a chart here real quick if I can find it. Where the heck it is? Just one second. There you go. This is just a chart basically showing the amount of kind of discussion in various sectors. As you can see, that IT sector and consumer goods kind of has the most discussion basically so far this year. But then this orange or kind of reddish bar shows, the number of sort of distinct cybercrime events. So, I thought this, when looking through SurfWatch Labs data, kind of really stood out to me. Although healthcare kind of in the middle, of the industries in terms of the amount of discussion, it seems like it's getting the most cybercrime activity. Part of that could be due to, sort of reporting requirements and things like that. But I guess one question we got out there from the audience is why aren't more companies concerned with their cybersecurity? Looking at this chart, it seems like healthcare is kind of standing out as, an area that definitely has a lot of cybercrime. So I'm curious with the sort of the people that you kind of talk with, or if you kind of work with anyone in the healthcare sector, I mean, are they concerned? Is it just that they're not concerned, or is it, like you guys are saying, budgetary issues? Maybe Barry, I don't know if you kind of want to take the lead on that.
Sure. With some of the ones I've spoken with in the healthcare arena, a lot of it does boil down to budgetary issues. They only have so much money to go around, and they have to focus on delivering of the best healthcare they can. But at the same time, especially for the major hospitals and whatnot that I've spoken with as well, they in some areas or some of the more rural type areas, they're basically behind in the technology arena. They're trying to, unlike say some of those in the East Coast or up in the Northeast that may have, dealt with bring your own devices for a bit now and worked out those bugs. I found some in some of the rural areas that they're just starting to roll it out now, and their main concern is how to track that piece of equipment so they don't lose it, not necessarily how to go about securing it. That doesn't mean they're not worried about security. They are, but they're trying to deal with a limited budget to give to be able to bring a new service on board or make things easier for their doctors to be able to provide health care and whatnot. So it's not that they're not worried about it, but in some cases, like I said, they're behind in technology, or it really does boil down to budget for what they're dealing with for most of the ones that I've spoken to in the smaller regional hospitals and whatnot.
Mm-hmm. Yeah, Jason or Kevin, do you guys sort of have any thoughts to add on that concern?
Yeah, I think, it really kind of comes down to, what an attacker is really looking for there. So when you think of the kind of information that healthcare providers are actually having, they have a wealth of personally identifiable information. So, on top of the fact that, they're having budgetary issues and that they're having problems keeping up with IT security, they also have one of the most profitable forms of information that an attacker could, use or sell. So they're a very, rich target there, which is probably, one of the reasons why they are attacked so frequently. And plus, because they're such a rich target, they're going to need a bigger budget than, other organizations might or might not do. People already kind of lament the cost of healthcare in the United States. In order to get those IT budgets where they need to be, that money has to come from somewhere. And more than likely, it would either come from insurers because healthcare costs are going to raise, and people already have interesting opinions on health insurance costs, or it would come from governments, or it would come from people's pockets. And none of it's a really acceptable alternative when, to most people, security isn't really something they want to pay for. It's kind of just this implicit desire. There's no tangible benefit to people. Healthcare costs, sure, people are willing to pay more for healthcare because, great, they can stop their kids from getting sick more frequently or get better care for their kids. But security, well, it just kind of happens. You don't get anything from that. until it's too late when you realize, you have, 4 Ferraris in your name on your credit report.
Yeah.
Yeah, I'll just echo what Barry and Kevin both said. I think it has something to do with the nature of healthcare. Unlike consumer goods, they don't really view protecting this data or cybersecurity in general as part of their value proposition, right? I mean, the goal of healthcare, for the most part, by its nature, is almost like a charity, right? They're doing work for other people, so protections on the valuable information are viewed as ancillary. They're peripheral. They're not a part of the budget, and as everyone's mentioned here today, budgets for hospitals, dialysis clinics, centers, all that sort of stuff, that, the budgets aren't big to start with to produce, to acquire the technology they need to serve their patients, which is really delivering their key value there. And so, they have to look for ways to cut costs everywhere, and healthcare is one of the largest sectors in the market that employs outsourcing. So client billing, processing claims, follow up with patients, so on and so forth. And that drives them to choose the lowest cost provider in many cases. And in many cases, they're opening the back door for people who care even less about security than they do. These are people who are really focused on squeezing every penny out of a service they provide for profit. So healthcare's got a lot of problems, and just traditionally, its own nature is part of the problem there.
Mm-hmm. Yeah, I guess one thing I'm kind of interested about is you guys are all kind of saying in terms of data security is kind of on the back burner, in the healthcare sector, which kind of makes sense to me. But at the same time, in terms of regulations, it seems to me, as an outsider at least, that healthcare, has the most regulations, in terms of protecting data. So you'd think with, all the legal requirements around it, that it would be more, on the front burner rather than on the back burner. Just kind of wondering if anyone can maybe Jason, if you can kind of.
Yeah. I think the danger there is that, there's a lot to say about regulation and policy and procedure and such. I mean, just because there's speed limits doesn't mean people aren't going to speed every day. I mean, you drive out on the highways, you see people blowing past you. So I think saying that healthcare is one of the most regulated or overly regulated industries is true in terms of protecting data, with HIPAA and everything else that you've got out there. But at the same time, it doesn't mean that these individual organizations are being any more careful or any more careless, on the other side of the coin with this data. And again, I think it all comes back to the cost of it all. The cost of implementing regulations, for example, HIPAA regulations, is far more taxing and burdensome on a healthcare organization than their cybersecurity. So there's really not much money left in the till at the end of the day after they have to comply with these regulations. So in a lot of ways, all these things really detract from them having any kind of focus on security.
Mm-hmm. Yeah, I guess, Barry, I believe, Dara Security, they, do assessments and pen testing and things like that. So is that something you see when you're working with these healthcare organizations, just that it's basically a budgetary issue for 90% of the cybersecurity issues, or anything else on that?
Yeah, no, mostly, like you said, and I see it as a budgetary issue, because I know that when we've gone in and worked with clients, or even with some of them where we've done an initial bid, and they're looking to get a penetration test done, or they're looking to get some type of assessment done to see where they stand with HIPAA. When they see the price tag, they usually come back, and that's not something that fit within their budget. It's not like we're trying to gouge them at the same time, but they don't know what they're asking. They have a number in their head that they can work with, and then they ask for the world with it. And so when they come back and look at what they can actually get done for that budget, it really does. It's an eye-opening experience for them sometimes in some of those regions that we work in, and it really does boil down to them for a budgetary issue, where they just come back and say, we just can't afford to do that with the other, can't afford to do that this year. We'll put it in the budget next year because we have to address some other part of HIPAA or some other part of the High-Tech Act that they have to deal with. So it's just something they're not able to address at that time.
Mm-hmm. Yeah, we have a question out there from Eric. He says, I was at the doctor's office recently and saw a list of passwords to all kinds of healthcare portals, like record storage, insurance, government data, etc., in plain view on the desk. What should regular customers do about security situations in everyday life? I don't know, Kevin, you want to maybe see if you can take a stab at that?
Well, I mean, that's pretty interesting. I mean, that's kind of like the Achilles heel of security is you could put in the best security in place, the strongest encryption algorithms, and keep records in a 4-foot thick steel vault, and as soon as the password to something is written down in plain sight, all those security measures go down the drain. As far as doing something about it, I mean that's kind of tough. It also largely depends on who it is. I mean, the difference between a hospital versus a kind of a small independent clinic, with 100 patients in a rural town. It's a tough one to say. Their security, their attack on security is going to be different. So one thing I think you could certainly do is if it is that big of a concern from you, ask your doctor or ask the receptionist, like, hey, I've been reading a lot about security in the news about healthcare organizations, and you just ask them, what are you doing with your patient information and things like that. It can't hurt to ask. That would be the first place I'd start. And if you see them doing something wrong, probably won't hurt to point it out either.
Mm-hmm. I just wanted to kind of move on a little bit towards, maybe some sort of current events. One thing I kind of see in a lot of articles that I read about healthcare, everyone's kind of talking about, we need a cyber Pearl Harbor, we need a big sort of event, to wake people up to, cybercrime in this industry or that industry. But I was, reading a little bit about community health systems, the past month, obviously. They had a breach, 4.5 million records. There's an article on Forbes by Dan Munro, I believe. And he was speculating that the total cost of that breach could be anywhere between 75 million and 150 million, once you add up all the different costs. That's just one breach. So, in my mind, it's like, it seems, if you kind of accept the premise that a wake-up is needed, isn't $150 million seems kind of like quite a wake-up to me. I don't know, maybe if, Barry, you kind of can maybe elaborate a little bit on the costs of breaches if they happen, or, kind of that concept I was talking about?
Well, the one would think, $150 million breach, that would be something that would be a bit eye-opening, and it probably is, and it will catch the attention of a few hospitals here and there, and whatnot. But one of the things to remember with hospitals, and to be honest with you, that's not one of their first breaches, or even probably one of the most expensive breaches that have occurred. There's been several breaches throughout over the last couple of years with hospitals. Either been a cyber attack from the outside, or a breach internally that's led to probably close to that amount of money in that $100 million range, and not to mention some of the fines that have come down from the government that now I can't even think of I think it's DHS, if I remember correctly, if I get the acronyms right with government, that passes out fines now and starting to actually do their own audits. But it sounds like a lot, but strangely enough, over the last 2 years, it still hasn't I can't say it hasn't woken that community up. They're starting to try to do what they can. But as far as with consumers, it surprises me it hasn't opened the eyes or caused people, as in the retail market, where consumers started worrying about, is Target really doing the right thing with their data? Is Home Depot doing the right thing? Patients haven't started asking hospitals or asking doctors more often, what are you doing with the data? But at the same time, you figure into healthcare, you're kind of a captured consumer. If that's the only hospital in the area, it's not like you're going to go to a different hospital. It's going to be kind of hard to do that, even if they did lose your data. But I think for a hospital, it's going to have to be, if you want to arrange it, call it a Pearl Harbor, it's going to have to be something on a bigger scale than $100 million. It's going to, because that's just not something, like I said, it's going to have to impact the hospital in a way of how they can deliver services, not just be some fine or something else that they can put in their budget and possibly go to their cyber liability insurance and get paid for, if you want to see an impact in that area. I think it's going to have to actually hurt the delivery of their health care. And so it's not going to be a loss of data. It might be a loss of services within that hospital, and that might be a bit more eye-opening than a loss of patient data on the security aspect, to be honest with you.
Mm-hmm. Yeah, Jason, do you sort of have any thoughts just on some of the different mean, everyone kind of thinks about, you get a HIPAA fine or something, that obviously impacts a hospital or a medical organization. But is there any other kind of costs, maybe that kind of get added and piled onto that?
Well, there's always cost of implementing anything, and paying attention to security in healthcare is going to be tough. As we've sort of beaten a dead horse here. Money's not funds are at a premium in healthcare anyway. It's not a terribly profitable business from top to bottom. Although you could argue the pharmaceutical companies are the exact opposite of that. But again, they're at the top of that pyramid. And healthcare itself, not the sexiest of topic areas, not the sexiest market area. I mean, most people see it as a political battleground. As Barry mentioned, it's a place you have to go, and oftentimes you don't have choices. I think that for there to be real change to eliminate a lot of these costs, and again, it's going to take money to change, but it's probably going to have to start grassroots style. There isn't going to be some other regulation that's going to come, even though there will be plenty of them, like HIPAA. But these things all cost money to implement. They pass on costs down. They trickle all the way down to the bottom to your local doctor, right? A small town, and ultimately, these the small grassroots level of the pyramid is going to have to start seeing this as an integral part of their value proposition and their profit, and they'll have to start taking steps to ensure their customers, consumers in this case, because everybody is really a consumer, that they're doing the right thing, and here's how they're doing it. Oftentimes, even simple steps like education, which healthcare is really, really good at, right? I mean, historically, solving infectious disease, propagation and such, and education, awareness has been a big part of it. And so it's probably going to start really grassroots to start overcoming these high costs, because when there's another HIPAA for security, if you will, again, a lot of these people just aren't going to be able to pay the toll, or they're going to, it's going to be at the cost of other services. So I really think that to stop this, it's going to have to start at that bottom level of the pyramid and kind of percolate up.
Mm-hmm. Yeah, I kind of wanted to maybe move forward into like some of the maybe effects, or kind of what are these cyber criminals after when they're targeting the sector. So we have a chart here, just kind of showing some of the effects of all these healthcare breaches, and kind of what's trending in terms of what people are sort of discussing. And looking at this chart, obviously there's a lot of things. There's fraud and vandalism and account hijackings and things like that happen, but it seems like pretty much it's the data that criminals are targeting, trying to steal that personal information, or various things like that. And as one of you brought up, I think there was a Reuters article about it recently as well, saying that medical information is worth 10 times as much as credit card information. So I guess a lot of people, like kind of as Barry was saying earlier, maybe they don't necessarily hold the hospitals accountable in the same way they hold retails people. So I think maybe there's like a gap of understanding in terms of what happens when you get your medical data stolen. I don't know, Kevin, maybe if you want to kind of just kind of talk about that a little bit. What are the criminals after, and then once they get that information, how are they sort of translating that into actual money?
Well, the way most cyber criminals will approach this problem for them is they'll get this information, and the first thing they're going to want to do is get rid of it, because having this kind of information on hand, it has no value to them in its form of information, and it's a huge liability for them. So the first thing they're going to do is they're going to go somewhere, either on like the Tor Onion network or something like that, and try and sell it and just get it off of their hands. And that's largely what they're going to do, and they're probably going to sell it to somebody outside of the United States. So that's primarily what we've been seeing that's been going on with that kind of information, and from there it's going to be resold. It's going to people are going to start stealing identities. I mean that's really what they're kind of after is healthcare information is in almost a complete profile of an individual's personal life, their finances, things like that. So, a lot of people, they have a hard time monitoring this kind of stuff. I mean, that's why it's also valuable. Credit card fraud, I mean, banks have had, things put in years to mitigate these problems. They'll cancel the transactions, everything goes away. We're improving credit card transactions, by moving to chip and pin technologies in 2015, but for things that is real identity theft, like opening up a mortgage or a loan in your name, that's really hard to undo. And it goes unnoticed a long time because most people don't have that kind of monitoring in place. People will usually notice a few $100s missing from their bank account or their on their credit card, but in terms of a $40,000 loan, how do you find out about that kind of stuff? I mean, unless you have you're doing some kind of credit monitoring, and even then, credit monitoring isn't real time. So by the time that information is available to you, it's too late, and you're going to spend years undoing that kind of damage. So that's particularly why it's such valuable information. Is you can get a lot of money from it, and we don't have good things in place to know about it. So we see like Home Depot and Target and those organizations, they're offering identity protection and credit fraud, but still, even then, most people just don't care about it. They don't think it can happen to them until it does.
Mm-hmm. Yeah, I guess Barry, is that pretty much been consistent, with like throughout the years? I guess I'm kind of wondering if there's sort of been any change in sort of what cyber criminals are targeting, or what they're doing with the information, or if that's sort of been sort of just a consistent thing, over the last 5 years, for example.
Excuse me. From what I've seen, it's been pretty consistent. The reason for stealing that much personal information is so you can do exactly what was mentioned earlier, was to be able to perpetrate not just some type of credit card fraud where you can create credit cards and go out on a spending spree like you see a lot what happens with some of the retailer breaches, but with somewhere like be it a hospital in the medical industry or even in the financial industry in some areas, you steal that amount of money, it's because you're going to actually perpetrate some type of identity theft, and so you can go out and get those things like a loan and whatnot, or buy a car under somebody else's name and stick them with the bill. And as was mentioned, a lot of people don't. It's not easily tracked in the sense of, I guess, or you don't easily get notified, because it's not like the banking industry or the people on the other side they're doing what they can to validate the identity, and if somebody has all the right documents, even if they stole them and created themselves, it's something that it's easy for them to do, and it's just not an area that's easily tracked. And as it's not like you get notified. It's not like somebody's calling you up and saying, hey, we want to make sure that this car loan's actually going to you, and or whatnot. And if you're not tracking your own credit reports or tracking to see what's out there about you financially, that identity theft and that financial fraud goes on for a long time. I know a friend of mine who didn't realize that apparently they had purchased 3 cars until they went to go get a mortgage. And when they did that credit check on them, the guy wanted to know why they had 3 different cars over the last 3 years, all with loans that were in default. So he had to go get his credit cleaned up, and it came out because it was a breach of some other organization. So it's pretty much the same, and as long as it's profitable, it'll stay that way. So.
Mm-hmm. Jason, we have a question out there. Matt wants to know, he says, assuming my credentials were stolen from a healthcare facility, what are the potential long-term effects for my family and myself? And I would say, we kind of touched on it a little bit here, but I think everyone sort of knows about identity theft, and they hear about it, but even speaking for myself, it's just kind of more of a abstract concept. I guess I don't know if you really have much experience in that, but if something were to happen, I mean, how much of a pain is it, and how much of an effect can it have on someone?
Well, I think Kevin and Barry have really touched on that already. The effects are. I think the interesting thing to note about it is that the effects are becoming much more commonplace. It's not uncommon these days to talk to your neighbor or to talk to your coworker and find out that this has happened. I mean, just in the last 2 or 3 weeks alone, 3 different people, just casually, in conversation have mentioned they've been compromised. Right? Some folks have had their ATM cards compromised. Some folks have been compromised point of sale. Things like Home Depot. I think the important part of this is to realize that one of the potential long-term term effects on family and people as victims is that they're going to have to start becoming more aware. Meaning, The solution is not going to be, it's not going to come through healthcare regulation. It's not going to come through better security, individually, meaning altogether, the consumer, the target, if you will, is a big part of this too. So I think one of the biggest long-term effects of all this that we're seeing the last few years and will continue through this decade is probably a heightened awareness on the consumer side of what can happen to them, right? They're going to have to be educated up to the level of, hey, I didn't think about it before. Now I realize I'm becoming a victim too. It's real. It's been brought home to me. And so, when they do go to their doctor's office, when they do swipe their card, when they do provide their information, people are going to have to start paying attention to that. I mean, unfortunately, it's it's just sort of old-fashioned advice, which is, you're going to have to monitor yourself and your activities and pay attention. And there will be other solutions that come out. There will be evolutions in credit monitoring and sort of identity monitoring and things like that that grow in pace with the threat to help people come to terms with this stuff. But just to drive the point home, I think one of the biggest long-term effects is that we all need to realize there's a requirement on us as individual consumers, whether it's consumers of medical services or buying something at Target, that we're going to have to start participating in the solution. It's until we do, there's going to be a big hole there.
Yeah, and I kind of wanted to get into sort of what those solutions are and what people in the medical field can do. Just a reminder, if you're watching this, we got about a half hour left, so if you have any questions about anything sort of related to cybercrime or healthcare, feel free to put them up, and we'll try to get to them. But yeah, I just wanted to talk, I guess one thing that really stands out to me and the people that I've interviewed and talked to is just kind of the complexity of the healthcare sector. I don't know if you guys agree with this, but to me it seems probably the most complex in terms of cybercrime and different attack vectors. Because you have a lot of hospitals, they're doing research, they're working with, colleges, they're working with students, they got to deal with insurance and Medicare and Medicaid. One person I was speaking to basically said for every dollar that a hospital makes, it's got to go through 6 or 7 different hands before it actually gets to that doctor. So I guess, kind of standing back and sort of looking at the problem, it seems, and I haven't even mentioned, medical devices and hospital equipment and all that kind of stuff. It just seems like there's 20 different things that you can worry about at once. So I guess sort of if you're kind of looking for advice to give someone or for like solutions, where should a person even start? I don't know, Kevin, maybe if you want to take that.
And that's a really tough question there because that's really going to be like the end game of this whole thing is fixing this is not going to be easy because like you said, that dollar goes through many different hands and goes through many different exchanges. So to sound cliche, your weakest link is going to be your weakest link there. I mean, if 6 out of your 7 hands all have really great security in place and one of them doesn't, oops, you're still going to have troubles there. And likewise, I mean, regulation. I mean, we can talk about regulation, but it's going to be tough there as well. I mean, it can be done at a state level, it can be done at a national level, but politics are going to get in the way of that. And anything that is put in place in a regulation is going to take many years to be put in place. Governments can't just decide, oh yeah, okay, by the end of 2015, you're going to have these security things put in place. No, they're going to have years to get this kind of work done because that's frankly what they need to get it done is that much time. And in so many years, we don't really necessarily know what the new attack is going to be. So as far as things that are going to be put in place, I think education is really going to be like just the key there because education is one of the relatively low-cost things that a hospital can do today is get its staff up to date, just really kind of drive home the point that patient data is of utmost importance at this facility. Because, as I think it was Barry that mentioned, that, sure, hospitals, they have USB keys with unencrypted data on them. Don't do that. What fell apart in that education chain that let that kind of stuff happen? Writing passwords down on, as someone had a question about, well, my healthcare provider, they have like passwords to all their portals written down on a piece of paper. What part of education fell apart that let that happen? So a lot of this that we're going to be able to just solve, I think the best thing that we can do starting, yesterday is get that education piece put in place, and then we can build on top of that education and start solving, the harder problems.
Mm-hmm. Yeah, Jason, do you kind of agree with that it's an education thing, or for where they should put their focus?
Oh, sorry, I was muted there. I think education is part of it. As you've already alluded to in the question, the problem with healthcare is multifaceted. I mean, you can say it resembles, in a lot of ways, consumer goods. There are increasing amount of point-of-sale type terminals. There's an increasing amount of data flowing back and forth. Healthcare probably comes in contact with as many, if not more, actual individual consumers every day as consumer goods does, but it's not quite the same at the end of the day. So it's a multifaceted problem. Regulation will probably end up forcing, creating the guidelines, setting the box. But the private sector, the healthcare organizations themselves, are going to have to look to all these angles: the consumer themselves, their own history with education and training, to solve the problems that they have to deal with every day. At the end of the day, it's probably going to be a combination of things, and private sector is going to figure out how to, with a profit motive, make all of this work together. They're going to ultimately be the glue here.
Mm-hmm. Yeah, Barry, do you have anything to add to that?
I'm not sure if I do. I think training will be a key piece. It's going to be something that they're going to have to work, not just the hospitals have to provide training, not just to their IT staff, but they're going to have to push out that security training to nurses and to doctors and things like that, so they understand not necessarily that the information is important, but how they need to go about protecting it so they don't have mishaps like I mentioned earlier, a lost laptop or a lost USB key and whatnot, and help them understand that the security is not there to be a hindrance. It's one of those, ever since I've dealt with in the healthcare arena, one of the biggest complaints is whenever they put some type of security in, people run around whining how it's going to hold up their delivery of service. That's one thing security can't be in the medical field, is a hold up to delivery of service, because if you're not careful, there's bad repercussions if something gets held up from the service delivery. But I think it's going to be training will be a key piece, and then from there we're going to see a lot. I think at some point you'll see a lot of technology start to evolve that's going to work better in the medical fields, because it is a very complex environment, like you mentioned earlier. And if, quite frankly, some of the security technology out there is not well fit for the medical field, for some of that service delivery. It puts in delays, it holds things up, and that's just not something that environment can have. And so until some of those things start to evolve better for that type of service delivery, it'll be slow there. And so training is going to be key until the technology catches up. So.
Mm-hmm. Yeah, I have one other kind of topic I wanted to quick touch on before we get into some of these viewer questions that are out there. I guess in terms of reading about cybercrime in the healthcare sector, one thing that's kind of always coming up, or you talk to your family and friends, everyone's kind of knows about medical device hacking. Maybe it's because of TV shows, people are exploding pacemakers and things like that, like on Homeland. But even just this morning, I saw an article, another researcher, hacked his insulin pump. And I think in terms of, what consumers are concerned about, I think that kind of maybe is even more so than getting their medical records stolen. I mean, obviously, someone killing me is, more of a concern to me than, having my identity stolen. But, I'm wondering what your guys' thoughts are in terms of how important that is, because it seems like it gets quite a large chunk of the conversation on a lot of these articles I've been seeing over the last week. But I'm just wondering if you think that's too much of an emphasis, or if that is something that people really should be concerned about. I don't know, Jason, maybe if you want to take that.
I mean, these guys may not agree with me, but me personally, I see these things as a lot of edge cases. Cyber crime in general, across any industry, healthcare, being one of the best, or one of the top examples, is the actual pure definition of green fields, right? I mean, there's not a lot of definition there yet. There's still a lot of exploits to come. I think hacking these medical devices and such are again, edge cases that inform in security research and drive controls back down to the manufacturers, and that's a good thing. But in general, I worry more about good old-fashioned everyday, day in, day out data theft, controlling access, network intrusion, core data breach stuff worries me a whole lot more than this stuff does. And as Barry was alluding to earlier, the subtext of his last set of comments was, all of this stuff is going to take time. I think it's the key element. We always want to ask questions like, well, how do you solve it? And in a lot of cases, it's a lot of things together, and then it's time. Things are going to have to trickle down. To use a medical analogy, when a new disease comes out and people learn how to attack it and learn how not to get it in the first place, it takes time for those sort of habits to trickle down through the patient demographic, and at the end of the day, years later, everyone's a lot safer. You don't hear about these diseases a lot more. So to me, it's not as impactful as the journalism makes it sound. I mean, it's frightening. Yeah, we should learn from it. In some edge cases, it could damage some things, but more importantly is what it says about the overall insecurity of the infrastructure.
Mm-hmm. Yeah, Kevin, I don't know if you have kind of any thoughts, if you agree with what Jason's saying there, or if you have a different opinion.
I actually agree very much so. It is a bit of an edge case because, when you think about, what people are after, it's like, okay, well, they're going to attack my insulin pump, and they can, overdose me with a shot of insulin and kill me. What's the motivation for an attacker there? What's their gain from that? And to be honest, there isn't one. In fact, you're actually less useful dead to somebody than you are alive, because as soon as that happens, they actually can't use you financially anymore. So there's really little to be gained from hacking those kinds of devices for other people, other than very, very specific attacks like you're a target by a national agency. But other than that, I mean, the motive isn't really there as far as I can tell. And but on the flip side of that, people are very much concerned about their lives. So the balance between how much attention are we paying to it versus how likely is this going to happen is kind of disproportionate there. It's really interesting research, and it is scary that it is like a general statement of how the medical industry is taking security. It's not a very good indicator of things, but I don't think that should be the place where we start solving problems first.
Mm-hmm. Yeah, and I think just like one concern, I guess, that I would have is obviously if you get a pacemaker, you get some kind of implantable device, that's going to be there for 20 years. It's how do you know, I guess, what's going to happen 20 years from now if they're going to find some way to turn that into a DDoS network or a botnet or something. So I don't know, Barry, if you kind of just agree with that, or if you have anything to add.
No, I basically agree with Jason and Kevin there. I don't think it's it makes for good TV. It makes for good reporting, but I don't see it being a major focus for cyber criminals unless unless there's a drastic change, or where they just want to start, for lack of a better term, whacking people that have these types of devices. The devices work. That was the reason that they created these devices. They probably run on older versions of software, older versions of embedded OS, and that type of thing. And it's not like it's that easy to go back and change it and make corrections. And so, but at the same time, I don't see it being a big target, other than, like I said, in the movies and for good TV. So.
Mm-hmm.
Yeah, Jeff, I just want to add one more thing there. Barry's point about it being good TV. I think all this is good. I welcome the attention, because I personally believe that over half of the solution for any problem like this is awareness and diligence in fighting it. And so drawing attention, again, forces that kind of trickle-down awareness to everyday people. If they get worried about their pacemaker being hacked, they're gonna start subconsciously even to be a little bit safer in other areas of their life. So I think all this stuff is actually necessary, and even though it is sensationalistic in some ways, it's all helping raise awareness.
Mm-hmm. Yeah, I think we should get to some of these questions that we have out there, so we can try to get through them before the end of the show. Kind of going off, what we were just talking about. One of the questions out there is, in your opinion, as experts in the field, have we seen the worst in these cyber crimes, or is the storm still approaching? So Barry, I don't know if you want to maybe take that, and do you think it's kind of going to get worse before it gets better? That's kind of what I generally seem to hear in these articles.
I don't think we've seen the worst yet. I think it will. I think we probably will see something major happen, bigger than what we've seen so far. And it's just because, like we talked about earlier, healthcare is such a green field of information and data that they're going to become a heavier and heavier target. And they're just not going to be able, and we talked about it already, the budget's not there for them to keep up with the attack threats and the vectors that they're going to face, and the services they have to deliver are going to cause them to, to be more cautious when they roll out security measures, because they cannot impact the services they're delivering. And so I think we're probably going to see, it'll probably get worse, it'll probably get bigger in the paper, we'll see more hits in the healthcare market before it starts to slow down.
Mm-hmm. Yeah, and then one kind of going off of that question, one thing I've read from a few different places is basically in terms of a timeline for when it's going to get better. I've seen the number 10 years, a decade kind of get thrown around. So yeah, Jason, I don't know, maybe if you kind of agree with that it's going to get worse, and if you do, do you think it's going to be a long ways down the road before we see improvements?
I think the thing that scares me the most is that it's going to get more widespread, and one of the potential byproducts of that is desensitization, meaning the public, and there's sort of this tipping point of awareness, and then all of a sudden you're bored with it. And I think the key will be the private sector providing very simple, highly adoptable solutions at the consumer level that'll allow them to make strides and protect themselves, or otherwise they're going to end up, well, who cares? It happens to everybody. It happens all the time. It happened to my neighbor. It happened to me. So I think if it's going to get more widespread is my worry. I tend not to pay too much attention to the sort of size and impact of these breaches, because I believe it's going to be a constantly crying bigger wolf as it goes along. And again, that's a good thing, but at some point we're going to reach this imbalance where people become desensitized to it, and that's my worry.
Mm-hmm. Yeah, Kevin, do you have anything maybe to add to that?
Not necessarily. I agree. The desensitization is going to be another one. Like, I think, with all of these thefts of credit card information at point-of-sale terminals, I think my bank has sent me like 5 new sets of credit cards because they automatically detect it. I was like, okay, at this point, I'm just expecting monthly shipments of credit cards. But that it is going to be tricky, and as far as like a timeline, it's going to be a sliding window. There's going to be a new problem probably in 2016 that we're going to have, another 10-year goal of trying to fix. So that's what security is in this industry is trying to stay ahead. There's no stopping. It's not going to be after 10 years we're done. It's going to be every month, every 6 months there's going to be a new 10-year goal. So we can't let our guard down, and accomplishing those things every 10 years is going to just take persistence.
Mm-hmm. One thing that I guess we've kind of come up quite a bit, during this discussion is sort of, the budgetary issue and, kind of as well, sort of government regulations and things. So we kind of have a couple of questions along those lines. Monica, she asks, do you think with healthcare.gov the government is going to take a more active role in protecting healthcare information if the money isn't there for the healthcare sector to do it themselves? So yeah, Kevin, I don't know if you want to try to take that. Is that something you see a possibility?
That's tricky because as soon as, there are already, some people that are on, different sides of the fence on what they think of healthcare.gov. Whether it's really, the federal government's problem, if we should be doing this at the state level with just state level exchanges. As soon as the federal government steps in, are people going to actively combat this and say, no, the federal government shouldn't be doing this, you're meddling in the private sector, which, it's all up to everyone's different kinds of opinions. But I think what we're probably going to see is, rather than taking a hands-on approach, we're going to see regulation trickle down from the federal level, the state levels, to maybe even municipal levels where these kinds of things are being put in place.
Mm-hmm. Yeah, Barry, do you kind of have any thoughts on that? Maybe the government sort of stepping in to kind of help boost security? Is that something you see as a possibility?
Um, that's a good question, and to be honest with you, I have to, I basically agree with Kevin. I mean, if the government steps in and starts providing money to hospitals to address security and whatnot, then you're going to have people on both sides of the fence saying the government shouldn't be involved. You have people saying they should be involved. And let's be honest. I mean, the government's already kind of involved when they passed HIPAA and the high tech. They said you need to go do these things, but do it with the budget that you already have in place. So it's not like the government provided them money, and now it's going to. I think you'd see the same type of atmosphere as you see now with the government trying to impose that everybody has to have health insurance. If the government starts to spend money now, giving money to hospitals for security reasons, or implement security measures, you're going to have the same type of outcry that the government needs to be involved in the private sector, or they need to keep their fingers out of it and let the hospital deal with it on their own. That's a tricky question, and it's a very political question, to be honest with you. So that could go either way, based on the feeling of the government at the time and the feeling of the whoever wants to go vote at the time as well. So.
Yeah, we kind of have a related question from Richard. He says, given the emphasis on protecting critical infrastructure, like telecom, utilities, power, etc., do you see healthcare as being one of those categories which the government might include under the umbrella as critical versus leaving to private sector management? Yeah, and I always kind of thought that too when you talk about critical infrastructure. It seems like, the healthcare sector, in my mind, that would fall into that. Jason, I don't know if you want to take a stab at that.
Well, I would say that healthcare is probably, from the government's point of view, a de facto critical infrastructure already. You look at all the emphasis on healthcare.gov, and to me, what it highlights more than anything is it's sort of the cybersecurity perspective on technology is highlighting about government that sort of old practices and procedures are going to have to evolve. I mean, the way the government acts, the way the government moves out and does things is in the spotlight right now with healthcare.gov because the foresight and the processes and the resources they had on hand to deal with that were just inadequate from the beginning. Yet at the same time, how are you going to really technologically take advantage in the best way possible of offering universal health care? You have to get out there. You have to do this. So ultimately, at the end of the day, we're going to probably look back a decade from now and see healthcare.gov kind of as a footnote that started a big, hopefully, a big evolution in government and how they handle their own business. Because right now, what it's doing more than anything is highlighting their inadequacy across the board. And so I would argue that just labeling something critical infrastructure doesn't equate to it being safer. And I would argue that most of our critical infrastructure isn't actually that safe. We just think that because it's labeled that somehow it's getting more attention. And that may be the case with budget and funding and things like that. But at the same time, again, it's just showing to me that the government needs to change. It needs to evolve. And hopefully we're at the sort of step of seeing that happen over the next decade or so. And cybercrime is really pulling it out into the spotlight here.
Mm-hmm. Yeah, we got a few minutes left. Before we end up leaving here, there is one other kind of aspect I wanted to kind of get you guys' opinions on. We've been focusing a lot on hospitals and health records and things like that, but obviously the healthcare industry is much broader than that. You have, for example, I think one story I read. A lot of the medical device manufacturers were being targeted. I think it was last year. I think it was the first half of 2013. Medtronic and St. Jude Medicals had people in their systems for several months. I assume trying to steal like IP and research. Then you have the pharmaceutical industry. So just kind of wanted to touch maybe on some of the things outside of the hospital. Maybe get your guys' thoughts on concerns there. Barry, I don't know if you want to start. Just is there anything that kind of stands out in your mind, sort of outside of the hospital environment, like with people stealing IP from pharmaceutical companies, for example, or anything like that?
If you're looking outside the healthcare arena, intellectual property will always be a a target as well, but that's more of a corporate to corporate or a business to business, or maybe even a foreign government, foreign entity toward an American-based business to be able to break in and take their intellectual property so they can replicate it back in their own country or whichever. If you want to talk about what I think will be from a breach standpoint or another heavy targeted industry or area, is the education field. You'll have universities and colleges and whatnot. They're going to, if you want to see another complicated environment that's easy to take advantage of, it's that arena, and especially if they have research facilities built into it, or they're doing any type of work with the corporate world. They're easy targets. Once again, another greenfield of personal information, be with their alumni, their students, their donors, any type of research patients they collect data on, and plus they're a great jumping off point if they're working with the healthcare arena, or if they're working with other private businesses. It's an easy area to penetrate, and then from that third-party network to jump off into those other environments. So, that's an area that we've seen an uptick in work with my organization, and it's a driving concern for them. And what's even more concerning is a lot of them, especially some of the smaller universities, they sit back and they talk about FERPA being their privacy regulation they have to adhere to, but all it does is tell them what they can do with the information. It's not even as detailed as HIPAA telling you how to go about protecting data and what you need to protect. And so that's just an area that I think is waiting to explode once again from a breach standpoint and whatnot. I don't know if that answers your question, but it's kind of what I'm thinking about at the moment.
Yeah, definitely. Kevin, I mean, do you have any kind of thoughts, on sort of things in the supply chain or, different kind of companies like that sort of might be, stand out to you?
Well, corporate espionage isn't really necessarily anything new. We've had, if you want to read some interesting stories, go read about the time the FBI got involved because someone from Coke was trying to sell Pepsi their recipe. But as far as how that's going to relate to medical things, I mean that's certainly going to be a problem, and it's a problem today. It's just that again, as far as how you and I and how everyone's watching is concerned, it's like, okay, well, the Chinese now have a very good intellectual property for curing some disease. Well, that sounds nice, I mean, it affects the business greatly because it affects their bottom line and their stocks and things like that. But as far as how much I care, well, maybe not so much. So again, you gotta kind of look back to how people interpret these kinds of things. And Barry's absolutely necessarily right. Having worked in IT in the education field for a university, I mean that's going to be something that's going to be going on because universities and hospitals, they kind of share very similar information. They have full student information. They have wealths of information there. They have everything about student loans. They have everything about the students and possibly their parents' personally identifiable information. That kind of information is going to become very valuable. And one of the things that is starting to become more and more common is identity theft of minors. Nobody thinks to do credit checks on a 16-year-old until that 16-year-old tries to apply for a student loan, and turns out he's already got one.
Mm-hmm. Yeah, we just have a couple minutes left here, so Jason, I don't know if you kind of want to chime in on that question, but then also just we talked about a lot of different things, so maybe if there's sort of one takeaway, kind of as we close this out, is there sort of one thing that sort of you'd want people to remember, I guess, from this discussion?
I think what we need is to create a new agency that looks out for our cyber backs. Wait, we already have one. Sorry, no, actually I think the biggest thing that we need to do is have, hopefully the private sector will do a lot more focusing on the lowest levels, meaning small business, individual consumer levels, because Education, healthcare, these are industries that are always going to lag behind security adoption, and so you have to look to their constituents as the main source of security there. So I think, for me, it's going to be this availability and prevalence in the marketplace of stuff that secures the lowest level, the most numerous part of the supply chain and the market in general.
Mm-hmm. Barry, quickly, is there anything, same question to you, I guess, is there sort of a takeaway from this discussion for, the people out there that are concerned?
I guess the big takeaway and it would be for, individually, if you're concerned, make sure you ask the question. If you walk in, like as Kevin indicated, walk in and you see that they have passwords posted on the board, ask them why they're doing that, especially if it's at the doctor's office and whatnot. As an individual, if you're concerned, ask what they're doing. At your small doctor's office, it's easy. You ask that office administrator, why do you have your passwords posted on the board? If you go to a big retail store, it's not that quite as easy to ask, but ask the question. If you see something that's bothersome, ask the question. Don't just ignore it and think that everything's going to be okay. So.
Mm-hmm. And then Kevin, same question to you. If you want to sort of take the last word.
Well, I mean, in addition to everything that my colleagues here have said, it has all been great information. The only thing I would always keep in mind is not to end on a doom and gloom note, but these kinds of problems, they're not going away anywhere. There isn't going to be a point where we're going to be able to relax, because whatever problems that we're going to solve today, there's going to be new ones coming down the road. So that's going to be the key to these kinds of things, is persistence. We're going to see new attacks, we're going to see new things happening in 2015 and 16 and things like that. So we're going to solve today's problems, and then we have to be prepared to solve tomorrow's problems too.
Mm-hmm. All right. Well, thank you guys for joining us. We'll put links to Dara Security, SurfWatch Labs, Thycotic Software. We'll put them in the comments, and we'll kind of write an article up on hacksurfer.com about this discussion as well. Well, thank you guys once again. And we'll be doing these webinars probably about once a month, sort of covering different topics. So stay tuned to hacksurfer.com for more on that. Everybody, thanks for joining us, asking questions. Appreciate it.
Thanks, everyone. Good to meet you.
All right. Thanks.